Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. But let's begin with the illusion of the week. Okay, today's magic trick may just be the simplest trick you've ever seen in your life. I call this the Australian Shuffle. What we're going to do is take 10 cards, all of the same suit. I have picked the 10 through ace of hearts. Now what I'm going to do is take these cards and shuffle them up using the Australian Shuffle. And I'll just let anyone who wants to call out whether it goes down or under. Get it? Down, under, down, down, under. We'll go through that a few times. Down, down, under, under, down, 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 or down, under, down, under, down, under, down. No matter what you do, the cards stay in the same basic order. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. Well, I certainly hope you enjoyed this week's magic trick. Right now, Root Tip of the Week. Before we talk about how to fill the canal, let's take just a moment and discuss single cone versus lateral condensation. All obturation techniques are single cone in the last couple of millimeters. So here's what we do. We fill the canal with sealer, and this is where most people make their mistake. One of the things you have to remember is as you withdraw the spiral that's placing the sealer in the canal, keep a tip of that spiral against one of the walls of the canal and pull it out slower than you're injecting the sealer. So the next thing we do is place our master cone that's already been pre-fitted down in the canal. Again, butter each one of them with sealer, slide them into place all the way down to working length. This is an 04 tapered cone, so it fills the space nicely. And at this point, we're going to take our extracted tooth, take it over and take an x-ray so you can see how beautifully the sealer has adapted to all the walls of the canal. Now we're going to sear off the excess gutta percha. I'm using the touch and heat from Cybron Endo. Even inside the sealer, you get a good cutting away of the excess gutta percha. Many times if you just heat an instrument in a flame, it cools off when it encounters the sealer and it doesn't completely cut through the gutta percha as we see here. And once we remove the gutta percha, then we're going to get most of the excess sealer back out with a 2x2 gauze pressed into the pulp chamber. And we'll go back in with the touch and heat again and remove any excess sealer that still may be up into the pulp chamber. We want to make sure we get it all the way down to the pulp floor. All that sealer's removed. Then we'll go back in with a little more gauze to make sure we get as much of that cement out as possible. And once we have all the canals thoroughly filled with the gutta percha, I like to seal the coronal opening with some type of light-cured material to get a good bond here. And this is how you get perfect condensation and nice lateral fills with a single cone technique. EZ-Fill Express comes with 2 complete syringes of the EZ-Fill material, AH26, the epoxy resin sealer, and a bag of the little mixing tips. Now this is what the mixing tip that comes in the kit looks like, and I'm going to recommend that you get a different tip. The reason I want you to use a different tip is if you take a look at this small access opening in this anterior tooth, you'll see that using the large tip that comes with the EZ-Fill system, it would be difficult to get that tip down into the pulp chamber and completely fill the pulp chamber with sealer. But instead of using this tip, you might want to get one of the other Automix tips that will slide directly into the pulp chamber. Now here's the mixing tip that comes with EZ-Fill on the left, and the one with the purple base is the one I'm going to recommend that you get. Well, that's it for another edition of the Root Tip of the Week. I'm Dr. Kit Weathers, and I will see you at the next Endo Root Camp.